Hello all, let's pass through the question. A 15-year-old female presents to the neurology clinic with complaints of persistent headaches, dizziness, and difficulty with balance.
Over the past few months, she has also experienced progressive numbness in her upper extremities and weakness in her legs. Neuroimaging reveals a downward displacement of the cerebellar tonsils through the foramen magnum and a fluid-filled cavity that extends along the spinal cord.
Which of the following developmental regions of the brain gives rise to the displaced structure?
A. Diencephalon, B. Mesencephalon, C. Metencephalon, D. Myelencephalon, E. Telencephalon.
Most candidates find neuroanatomy challenging, but let me simplify it for you. Today, we will discuss the embryology of the nervous system. First, take a look at the process of neurulation. Stay on track with the cross-section images on the right. If you have gone over embryology, you would know that at the second gestational week, a primitive streak appears in the bilaminar germ disc. This gives rise to the ectoderm, endoderm, and the mesoderm. At 3 weeks, the notochord appears, causing the conversion of the ectoderm into a neuroectoderm, which gives rise to a neural plate. The neural plate then folds upon itself to form neural folds, ultimately resulting in the formation of a neural tube, along with neural crest cells. This process is called neurulation. At 4 weeks, anterior and posterior neuropores, or openings of the neural tube, fuse. Here is a summary of neural development. Navigate your drone to 5 weeks and see how after fusion of the two ends, neural tube swellings appear. These give rise to 3 primary brain vesicles. Look at how the swellings have developed. It is vital to know each part of the developing brain and their derivatives. The 3 primary brain vesicles, prosencephalon, mesencephalon, and rhombencephalon, give rise to the forebrain, midbrain, and hindbrain respectively. The prosencephalon divides into telencephalon and diencephalon. These are secondary brain vesicles. These give rise to cerebral hemispheres, basal ganglia, thalamus, hypothalamus, and cavities corresponding to them, the lateral ventricles and the third ventricle. The mesencephalon gives rise to the midbrain and a cerebral aqueduct. The rhombencephalon is divided into 2 parts, the metencephalon and the myelencephalon. The metencephalon gives rise to the pons and cerebellum, whereas the myelencephalon gives rise to the medulla. The upper and lower part of the fourth ventricle are also formed by the rhombencephalon. As the CNS is being formed, the following specialized cellular features develop. The neuroectoderm gives rise to the neural tube. Neural tube gives rise to the neuroepithelium, which is ectodermal in origin. This gives rise to neurons, oligodendrocytes, astrocytes, and glial cells. These are specialized cells of the central nervous system. The neural crest cells develop into the peripheral nervous system neurons and the Schwann cells. The mesoderm gives rise to microglial cells. Since we have gone over the derivatives, some important clinicals in context of the developing brain include malformation in the posterior cranial fossa, especially the cerebellum, which develops from the metencephalon. These include the Arnold-Chiari 1 and 2 malformation and the Dandy-Walker syndrome. It is important to know the underlying pathologies that may be associated with these conditions. For instance, with Arnold-Chiari 1 malformation, a patient usually presents with syringomyelia. With Arnold-Chiari 2 malformation, meningomyelocele and syringomyelia is common. Dandy-Walker syndrome is associated with spina bifida. Note the displacement of the structures through each of these conditions. This table is very handy in learning these malformations and will give you a concise overview of the clinicals associated. In today's question, there is a 15-year-old female who presents with persistent headaches, dizziness, and a displacement of the cerebellar tonsils through the foramen magnum, along with a fluid-filled cavity that extends along the spinal cord, also called syringomyelia. There is a downward displacement of the cerebellum, which arises from the metencephalon. So the answer is C. Feel free to go over the answer explanations. Here is the key point. I hope you are enjoying learning. Don't forget to like, share, and subscribe.